Right, so patients with CLL historically were treated with chemoimmunotherapy. Some years ago, we decided to create a regimen which includes some chemotherapy, 3 cycles of chemotherapy, combining it with Ibrutinib, as well as replacing rituximab with Obinutuzumab. We call this regimen the iFCG regimen, and we only designed it for patients who were young, fit, and who did not have deletion 17p or p53. So over the course of last 6-7 years, we have treated 66 patients on this study, and that's the group of patients, the total cohort we are reporting at this ASH meeting, where we saw a very high rate of undetectable MRD in the bone marrow by flow cytometry at 10 to the power minus 4 sensitivity. In fact, 63 of the 66 patients achieved undetectable MRD, which is a very high rate of undetectable MRD achieved with a regimen. And what we also saw that in the long-term follow-up now, upwards of 90 to 95% of the patients were still in progression-free. And in fact, we only had 1 patient where the disease has recurred so far. So overall, this regimen seems to be quite promising for patients with CLL. However, one caveat here is that the field of CLL in general has moved away from using chemotherapy. So with that in mind, I think the clinical value becomes a bit limited. But I think for institutions or for centers where chemotherapy is still considered for patients with CLL, I think this could be a really good regimen for IGHV-mutated young patients.